Hi, I'm Andy Fradkin, and this is Zach.
And I'm Amy Fradkin, and this is Alex.
So Zach is our little guy here. He's 5 years old, and he has juvenile arthritis. And he is our little cuddle bug that we love so much.
When he was 18 months old, right, it was Labor Day weekend, so this would have been 4 years ago, he fell and he started limping and called the pediatrician, and they said, well, don't go to the emergency room, just wait, we'll see you on Tuesday. Come in after the Labor Day weekend, give him Motrin, make him comfortable. And the Motrin seemed to help. And he saw him on Tuesday, checked him out, no broken bones. He probably just twisted his knee or something. Not being able to walk, not being able to crawl, pulling himself by his arms. We were, I guess in a sense, fortunate because his symptoms progressed so rapidly. And the doctor ran some tests, had him run a leukemia test and ran the blood test for arthritis, looking for a certain marker in his blood work for the inflammation. And it came back positive.
It was scary. Not really knowing what was going on and seeing him in such pain where he couldn't even crawl. He was just dragging himself around by his hands. And when pediatricians said, "Oh, it might be arthritis," the first thought is, arthritis. He's 18 months. Arthritis is for when you're older and you've got that sports injury or whatever. That's my view of arthritis up until then.
So Zach is a wonderful patient, but he is a challenge. One of the most difficult things about Zach is that I started taking care of him when he was very young. When we start taking care of patients whenever they're so young, they can't tell us what they're feeling. So we have to rely on the observations of their parents to figure out what's going on. Zach also has been a challenge because he has autism as well. That means that as he's aged, he hasn't learned those abilities to teach us and tell us what's going on with his joints. So as an example, we've tried to use the non-steroidal drugs with Zach because they tend to be very effective, but he has a lot of trouble with what he can eat and with upset stomachs. So we never knew if that was because of his arthritis or the medications or if that was just a function of his autism. And that's been a continuing challenge. In addition, Zach has been wonderful in that he's allowed his parents to give him pills. But in children as young as him, our choices for medications are very limited because only certain medications are available as liquids. And many of the tablets can't be crushed or have a very foul taste, and so the children won't take them. Zach's disease has been difficult as well because it's progressed over time. He started out as what we call an oligo, which means that he had only a few joints affected. And initially, he did great. We had to use several medications to treat him, but he responded well and we started to taper his medications off. However, over time, once we tapered those medications off, we realized that his arthritis had flared. And unfortunately, when it came back with a vengeance. And now he's a poly and has disease affecting multiple joints. Poly means more than 5. And Zach has involvement of his hands, his feet, his knees, and it's been quite difficult for him.
It shouldn't be the main thought on their minds is, will this flare up? Will I be in pain when I'm just having fun? So the Jingle Bell Run just seemed like something different, something kind of fun, being that it was, you're doing a walk or a run outside in December, which most walks and runs don't take place, and it just seemed like a way to give back to help the Arthritis Foundation that helped us. And there's a couple of different Jingle Bell runs coming up. November 17th in Portage, December 7th in Northville, and December 14th where you can see us in Bloomfield. So come join us.